Hello, students. Long time no see. So, my class and I are talking about vocabulary for different parts of your body and medical problems connected to each part. So, I am going to make a two-part video. One video today, we will talk about different medical problems. As you know, there are a lot of medical problems, but I want to give you some of the most common ones so that you are familiar with these vocabulary words if you or someone in your family get sick or they have a problem with these. The second video will focus on different verbs depending on what body part we focus on. So let's get started. Let's talk about the different types of medical problems. But first, before I start that, let's start with the most common. You have these two very common sicknesses, right? You have the flu, and you have, typically we say the flu, and you have a cold. Which one is worse? The flu or the cold? What symptoms do you typically experience? So when you go to the doctor, your doctor is going to ask you about what symptoms you feel. So with the flu, to help you remember F, you will experience a fever. Typically connected with a fever, where your body is hot, sometimes it's hot and cold. So you have body chills. So you're feeling hot and cold. This verb is to shudder. You're shuddering. You also experience body aches. Every part of your body hurts when you wake up in the morning, right? You feel like, your shoulders are stiff, your head hurts, maybe it's a migraine, a headache, a fever. But this is the other difficult part. A common cold, has some symptoms of the flu. Sometimes they share these symptoms. So a cold, you may have a cough. You may you may sneeze. Now, when we talk about a cough, if you cough a lot, typically you will have a sore throat. This will hurt. So the neck is outside, but inside is your throat. So typically you need to drink tea, some soup when you have a sore throat. For your nose, your wonderful nose, when you sneeze, sometimes you have boogers. Sometimes you have a runny nose. If you have allergies, you also have a runny nose, where maybe you need a tissue, right? You have runny nose. The opposite is when you don't have air. There's no air going inside. So you have a stuffy nose. I hate this problem because when you try to sleep, there's no air entering your nostrils. These holes are called your nostrils. So these are just some very fast examples, but the flu also shares these symptoms. But what is different about the flu is you're going to experience a fever, your body aches, and body chills, okay? Now let's go into more specific body parts. Okay, now let's get started. So, as we talked about your head, this is your head. But your skull is the bone of your head. This is called your skull. This is your forehead. So if you have a fever, you touch your forehead. If you have a bad headache, You touch the temples. You need to massage the temples of your head. So, what are some common issues? Issues, that means problems, concerns. What are some common issues? Well, one, a headache, not ach, no, headache. If it's worse, you may have a migraine. A migraine makes you sensitive to noise and to light. If you had a car accident or you're a soccer player, football player, and you hit your head very hard against something else, you may have a concussion. A concussion is very scary. It's when your brain hits the inside of your skull very hard. Sometimes if you have a concussion, you can't remember things. Your memory is not strong. So if this happens, you need to go to the hospital immediately. The doctor needs to examine your brain. And another common issue, you can feel lightheaded or dizzy. And sometimes that can cause you to faint. So this is the verb faint, right? But the adjective is lightheaded or dizzy. Now let's look at your beautiful eyes. You have your eyes, the skin of your eye, this is called an eyelid. And you have your eyelashes and your cornea. So the cornea is the outside part of your eyeball. Your eye is a ball, but the outside, the front part, is your cornea. So sometimes you might have blurred vision. This is different than me taking off my glasses and things are blurry. Blurred vision is when you can't see. Things are not clear. You may have pink eye or red eye. What is the difference? For both situations, you have red eyes. But pink eye is typically bacteria. So if you don't wash your hands clean, like nicely, and you go rub and touch your eyes, then you have pink eye. Sometimes you need special antibiotics or drops for your pink eye. Children often get pink eye. They play outside, they pick their nose, and then they touch their eyes and they have an infection. For red eye, there's a lot of different reasons to get red eye. It could be because you're using the computer too much and you are not blinking. It could be because your eyes are very dry. If you have allergies, this may be a problem you have. I have this problem where I get red eyes and I need to put special eye drops every day. A sty. Oh, a sty is painful. On your eyelid, you see there's a bump here. That is a sty. Typically, a sty goes away on its own with time, but you need to keep it clean and sometimes use a warm compress. So maybe a warm, wet towel that you put over your eye. Eye floaters. These are eye floaters. If they go away, that's okay. But sometimes when I go out in the sun and my eyes are adjusting to the bright lights, I see little dots. These are eye floaters. But if you continue to see them all day, then that's a signal, that's a problem. Glaucoma. I want to show you a photo of glaucoma to give you a better idea of what it looks like. So this is normal vision, but if you have glaucoma, you notice that you cannot see around you. Your vision becomes more and more narrow, right? That is glaucoma. The final thing is color blindness. Some people cannot see the number 5 in this circle. Maybe they can only see certain specific colors but not others. So you may need to take a test to see if you are colorblind. Oops, sorry. All right, let's talk about your mouth, your lips, your teeth. Teeth are plural. If it's one, it is your tooth. Your gums. Your gums, not like the gum you chew, but these are your gums. Here and here, above your teeth. You have your tongue and your tonsils. So before we talked about the flu and the cold, if you have a sore throat, your tonsils are sometimes swollen. And we have specific names for different teeth. That's not so important, but your molars are typically where people have problems, and those are the big teeth in the back of your mouth. So what are some common issues? A canker sore. A canker sore is like this, a little bump inside your mouth, maybe the gums of your mouth, and it stings. Sometimes you need to wash your mouth with a little bit of warm salt water. You gargle it, and it helps keep the area clean. Cavity. Children that eat a lot of chocolate, candy, and they don't brush their teeth after, they may get a cavity. It's when your teeth is rotting. Not good. A toothache is just generally when you're something in your mouth, one of your teeth hurt. This is a toothache. Not really a problem, but you can go to the dentist for a chipped tooth. A chipped tooth looks like this, where part of your tooth is a little broken. All right, gum disease. So again, inside your mouth, these are your gums. You can have gingivitis. So you need to make sure you're always flossing and brushing your teeth regularly. Listen to dentist Dr. Caroline. And final one, swollen tonsils. These are your gums. Let me show you a quick photo. These are your gums. These are when you have problems with your gums. They're angry. They're very red and swollen. Let me show you very quickly. I'm going to return to this, but I want to show you inside your mouth. These are your tonsils. You see, these are inflamed or swollen tonsils. They are red and they hurt when you swallow. Okay, let's talk about your beautiful nose. So your nose, you have your nostrils. This is how you breathe air. You have 2 nostrils. You can sneeze, achoo. You may have a nosebleed, or a runny nose like this girl and this boy, or a stuffy nose where there's no air entering. Your throat. You may have sore throat, but if you have this problem a lot and very frequently, you may actually have strep throat, where you may need antibiotics, stronger medicine. Strep throat is for people that experience like sore throats often. It's a good time to go check with your doctor. Swollen tonsils, we talked about that. Now, in terms of a verb connected to food, you may choke on food. You cannot swallow the food. It gets stuck here. So you choke on your food. You cough like coffee, cough. And when you cough and you spit, if it's clear, then that's maybe just mucus. If you have allergies and you spit, you might have clear mucus. If you are sick, you have something called phlegm, and it's typically yellow or green. It's gross, right? It's yellow or green phlegm. And that typically means you have some sort of infection. Okay, let's talk about your chest. Common issues. If it's just general, you don't know what the feeling is, you can say, oh, I have chest pain. And you can tell your doctor if it's a strong feeling, it's sharp, or is it soft? Is it just a little bit? Is it dull? So sharp pain is it's very intense. Dull pain is you feel it a little, but it's in the background. You may have an irregular heartbeat. So your heartbeat, it goes ba-bum, ba-bum. If it's irregular, the rhythm is off. It might be like boom, 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 right? It is not consistent. You may have asthma, where it's difficult to breathe. For these patients, they need an inhaler to help them breathe, to get oxygen into their lungs. You might have a heart attack. When you have a heart attack, you typically feel lightheaded. You have a shortness of breath. You cannot breathe normally. These are short breaths. And typically a part of your body goes numb. You can't feel your hand. You can't feel your arm. This feeling is called numb. You may have heartburn. Sometimes the acid from your stomach, it can go up. It travels up. So it maybe leaves you with a bad taste in your mouth or bad breath. That's heartburn. Or you might have a panic attack. My students and I talked about this, where different people in their family experience panic attacks. My recommendation is, first, of course, talk to a doctor. But two, if you are next to someone who is experiencing a panic attack, they need to breathe. So scientists are recommending that you inhale 2 times, you hold your breath, and you slowly exhale. You need more oxygen going into your body. So okay. Now your stomach, your beautiful digestive system. If you have stomach problems, it might be because of indigestion. So in means no, not. Indigestion means, oh, you have problems with the food going down. You may have constipation. Constipation is not fun. You cannot poo. You cannot go to the bathroom. Okay, typically when you're stressed, your stomach is tight and you can't go to the bathroom. The opposite problem is diarrhea, where too much is coming out, okay? Diarrhea, you can't stop it. So constipation, it's stuck. It's not moving. Diarrhea, the opposite. Everything is coming out. You may have a stomach ache, like this boy. A stomach ache, a general pain. You don't know what it is, but your stomach hurts. Cramps. Women that have their period, you may experience cramps. Or athletes, when you're running, maybe the side of your stomach hurts. The side of your abdomen hurts. It's a cramp. It's a strong contraction. Maybe you're vomiting, right? Or, as Americans say, you throw up. Throw up. You may have food poisoning. You ate something bad. Maybe the chicken was not cooked. It was raw. And after you ate it, you ran to the bathroom because you were throwing up. You have food poisoning. If you have food poisoning, sometimes you have body chills, right? Your body might be hot and cold because it's sick from that bad food. And you might fart. You have gas, a lot of gas in your stomach. So sometimes you might need to fart. All right, so I always tell my students that if you have stomach problems, it's a good idea when you're sleeping, you sleep on your left side. Look at this diagram. You see, this is your stomach acid. It's going to be traveling up. If you sleep on your right side, it goes up and it gives you more problems. If you sleep on your left side, it does not. So if you have stomach problems, please sleep on your left. Okay, general problems with the body. We are almost done here. So let's talk about your skin. You can have cracked or dry skin like this, where you need to constantly put lotion. Sometimes this cracked or dry skin we call eczema. So those patients need special types of lotion that are very strong to help protect the skin. The opposite is oily skin, where maybe you don't want so much lotion because your skin feels greasy. You may have sunburn. In beautiful California, a lot of people are going to the beaches right now. If you don't put enough sunscreen, it might burn. You may have a skin rash where everything feels itchy, right? You may have acne or pimples. Adults and teenagers both get this, right? You break out. You might have pimples or acne on your face or your back or your body. A blister. The example I gave my class is women, especially women. When you wear new shoes, especially high heels, the back of your foot, you may get a blister. It's kind of like a little it's like a bubble. This is an example of a blister. When you wear new shoes, sometimes you get a blister here. It hurts. That is a blister. It is your body, it's like a bubble. Your body is trying to protect itself. Don't pop the blister. A bump. A bump can be anything. If I hit my head, I have a bump on my head. Or if I have something here, I have a bump. Maybe it's a mosquito bite. Oh, maybe it's a spider bite. I don't know, but it's a bump. Burn. You may burn your hand. I burned my hand when I was cooking on Saturday. Burn. It could be from fire or it could even be from ice for a long time. If you put your hand or your skin on and you put ice on it for too long, you can burn your hand. And a scar. A scar, after you get a cut and it heals, you still see it on your body. For my legs, I have a lot of scars because I'm clumsy and I fall a lot. So scars don't always go away. Sometimes they are permanent and they stay there forever. So let's look a little bit at cuts. Cuts, you can have a deep cut or a shallow cut. A shallow cut is just a baby cut. It's a little problem. You don't need to go to the hospital. But if you have a deep cut like this and you can't stop it from bleeding, you must wrap your hand or the body part and you need to apply pressure and go to the hospital. The doctor will give you stitches. These are stitches here. These are some other more general examples. If you have a sprain or fracture, so if you sprained your ankle, you twisted your ankle and it hurts. It's swollen, but you can walk on it. You can go to work. But if you fractured your ankle, you broke it. Fractured or broke are the same. So if you broke your ankle or your foot or your arm, you need a cast. This is a cast. For months, you need to wear this cast and you can't bend, you can't move that part of your body. It needs time to heal. Sore muscles. This could be for anything. If you exercise, oh, my shoulders, oh, my legs, oh, my abs, they are sore, meaning you worked out, your muscles are tired. Body aches. So we talked about body aches for symptoms of the flu, but I want to just make sure you pronounce this correctly. I tell my students, think of the word cake. The final part, cake, ache, ache. That is the correct pronunciation. So stomach ache, headache, back ache, tooth ache, ear ache, ache. In general, if you go to the doctor and you want to explain or express that some part of your body hurts, you can say, okay, the body part in pain. Shoulder pain, oh, abdominal. This is where your stomach is, this area. Your abdominal pain, hip pain, or groin pain. Groin pain is where your private parts are at. This can be for women and for men. For the Olympic ice skater Michelle Kwan, she had a groin injury. So it means that it might be difficult to walk or your flexibility is limited because of that area. Burn. We talked about this before. So I burned my hand. Or I have a burned hand. Bruise. So bruised with a D is the adjective. So I have a bruised leg. Oh, I have a bruised arm. Bruise. If you have a pain that you experience every day, not for a short time, but for months, for years of your life, this is called chronic pain. So you may have chronic back pain, meaning your back hurts a lot for a long period of time. I hope that helped you. I know it was a little bit fast, but this is just to review some of the key vocabulary words we studied connected to different body parts. I hope you enjoyed the video, and I will also be including part 2. The second part of the video is different, but it will talk about separating body parts and talking about specific verbs we use to connect to each of these body parts. I hope you had fun, and I will see you soon. Good job, everyone, and keep up the amazing work. If you have any questions, please let me know. But otherwise, I will see you later. Bye, everyone.